Hey everybody, welcome back to the show. It is always a pleasure to see our next guest and learn about new stuff.
Yes, and well, I was sad about the lack of sun. He was really sad about the lack of sun because it's business, baby. Dr. Martin Braun joining us, Vancouver Laser Center, to talk about some new therapies.
How are you, Dr. Braun?
Very good. Thanks for inviting me back to the show.
No problem. So this is better for our skin, right? When it's cloudy like this is the good thing we can find.
Yes, yeah. Well, that's why in the rainforest we don't have as much bad skin as down in California or New Mexico.
Right.
Because we're walking around in a virtual spa, we can think about when it's raining all the time.
With 100% humidity as well.
Yeah.
You don't dry out.
Very liquid humidity.
Now, we're going to talk about a couple of treatments I've never heard of today. These are non-invasive, non-injectable treatments. What are we talking about?
Yes, just heat-based treatments to tighten the skin. Everybody wants to get a little tightening of the jawline or lift the brows because it's all going south. And so it's nice to do it without any needles if you can. Yeah. And that's Thermage and Ultherapy are two of the treatments that we use.
Okay, let's talk about Ultherapy first. Yes. And we have a couple of photos, some before and afters. So once again, you're using heat, and what does the heat actually do?
The heat contracts collagen and creates new collagen. Heat is your friend with any of these laser devices.
Okay, and this is using ultrasound? Is that what it is?
Yes, yeah, it's focused ultrasound. So the ultrasound wave is focused beneath the skin. You can dial in at 3 millimeters, 4.5 millimeters, whatever you would like.
And is that different in different areas of the face?
Yes, depending on how thick the skin is, how much subcutaneous fat the person has.
And it's good for under the eyes because most people get that kind of aging and gravity, that crepey kind of under eye skin. Not that I'm thinking ahead. No. Not.
Yes.
As you're saying it, I'm like, are you looking at me?
We're looking at another before and after here under the eye.
Stupid question number 2 from me. What is collagen?
And collagen is just the main protein in your skin. And it's a triple helix like a rope. And it's interweaving, and you need as much collagen as you can to have nice thick dermis, you know, the deepest layer of the skin. The thicker your dermis, the more generally you'll glow. You look more radiant, less wrinkled.
Does this just break down over time, collagen? Is it time, gravity, sun exposure?
We estimate you lose about 1% a year after age 20, just to age, and it doubles in sun-exposed areas.
Oh, interesting.
So the face, I mean, so by the time you hit 50, so someone like me, I'm 53 now, I would have lost 30 to 60% of my collagen. So I'm trying to reduce that rate of loss by doing these treatments.
Right. Okay, let's talk about another treatment. I've never heard of this one either. It's called Thermage. What is it?
Thermage is using heat as well, but we use radio frequency, just another heat source instead of ultrasound. And it's non-invasive. It's been around longer than Ultherapy, almost 8 years now. We've had it in the clinic, and they've improved it over time. We're on the 3rd generation.
Yeah, that must be an interesting part of the business, the improvements in the existing therapies as well as people get used to using it and you know, you find things out as you go along.
Yeah, and then you mix it with injectables and it's very safe.
You just have a little party. Exactly. At what age do people start doing these kinds of treatments, the heat-based ones that we're speaking of today?
They're getting earlier now. Some women are even starting in their 30s now because it's been shown, and I've had a few patients that we've done yearly now, how nice it's accumulative. The jawline really does stay up the more you do.
Is that what we're looking at in this photo here?
Yes, there's an example as well. You know, and she's 1 year out, well, 10 months post-Thermage right there, and you can still see tightening. So you get it done at once and it lasts that long?
Oh,
yes, yeah, it should. It should. It, again, depends how much collagen you make.
Bring it on, Dr. Braun.
Well, I mean, everyone has this idea of the facelift, right? Like the old school sort of, and is this replacing or is this delaying if you choose to go that route?
I would say delaying more than anything. If you mix injectable treatments such as fillers, Botox, these heat-based treatments, you can delay a facelift. And if you do a facelift, you'll have a much nicer facelift because the skin is more wrinkle-free.
So, I mean, there's all these therapies that we talk about every time you're on. So how much of it is influenced by individuals, by, you know, either their choices or their skin type or what they're looking for? I mean, obviously there would be a sort of, you know, different ways for different people.
Yes, yeah, and everyone has different things they focus on. unfortunately, patients, many of them are two-dimensionally focused. They can only see themselves in a picture or the mirror. Everyone else sees you from a million different angles.
Right.
And so when they come in, they'll have a concern. For example, I have a broken capillary right here, and I'm looking at them thinking, that's the least of your problems. You know, and so then you try to...
Okay, do me, Dr. Braun, do me.
It's the honesty that makes the comedy.
Yes,
but that is part of
exactly.
it. I mean, is getting that outside consultation, and you know the cascading effects. You know all these things that are going to happen in sequence as people age as well, right?
Yes.
Is Botox still the most popular treatment that people come to see you for?
Yes, by far. It's
and
still number
what is
one.
next in line that people
Next
are doing?
in line
hair
would
removal?
be laser hair removal, correct, is the most popular
just
laser.
piped in
I'm just guessing.
Yes,
I'm just guessing.
But we should talk about laser hair removal because it is the summertime is approaching. It seems like the technology.
Summertime is approaching. We're halfway through it.
Yeah, not
It is
in
approaching
Vancouver.
right now. It's coming for you, Mike.
Let's hope
but
so.
It's improved so much with the technologies with laser hair removal. Yeah.
Yeah, I had the first laser in Canada for laser hair removal in 1996. So look, in 15 years, how far it's come along. I mean, you can see it on almost every corner.
What's the pain factor like in the one from 1996?
Much less now.
And
much
works
less.
much better across a broad spectrum of hair types as well, which was always an issue with lasers.
Even for darker skin now. Nice. So you can really offer people good treatments, and the vast majority of people respond really well. Nice. Some don't, but most do.
Dr. Braun, thank you so much. Always nice to see you. If you want to find out more, go for a consultation. Dr. Braun's website is on the screen for you right now.
I'm going to look 25 and like a hairless chinchilla for my entire life. It's going to be beautiful. We're going to take a break.